Hello, my name is Madeline Ambrose, and I'll be introducing this TED Talk on healthcare education and intercultural communication in healthcare. The first topic is understanding global healthcare systems, and this can be seen in models like the Bismarck model from Germany, the Beveridge model from the United Kingdom, the National Health Insurance model from Canada, and the out-of-pocket model seen in places like Africa. So overall, the American healthcare system is exemplified through different types of these models. The United Kingdom system can be seen in how we treat our veterans at the Veterans Affairs hospitals. Canada's model mirrors American treatment for the people over 65 on Medicare. And when Americans get insurance through their job, it is similar to Germany's system. This is why the United States healthcare system is so complex and ultimately why it costs us a tremendous amount more than other countries. It is important to note that Americans are not receiving more or better care than other countries. The United States provides one of the lowest numbers of practicing physicians per 1,000 people in the population, have a more expensive cost for hospitals, physicians, and diagnostic imaging, lower life expectancy, highest infant mortality, and the highest rate of obesity and chronic conditions. This next topic is finding healthcare assistance in areas near you. Providers organize and deliver a significant level of health care through safety net organizations. They're available to the uninsured, Medicaid, and other vulnerable populations of the United States. As of 2015, 19.6% of the population was under Medicaid and 9.1% of the population was uninsured. Vulnerable populations encompass certain races or ethnicities, socioeconomic statuses, which would include income, education, occupation, and wealth. Gender, age groups, disability status, geographic location, and sexual orientation. For example, women, elderly, pediatrics, rural areas, and disabled people tend to be the most vulnerable in a population. Safety net organizations are implemented into communities and they won't turn away patients, and payment is made by federal funding based on a sliding scale or having reduced rates or is free. Below are listed some of the resources for federally qualified health centers, street medicine resources, and health professional shortage area resources. Follow these links to figure out how these can help you.
Now we're going to discuss the language barriers in the healthcare system. On the graph on the left, it shows the percent of people over 5 years old who speak another language at home. The light blue represents 9.7% or less of the population, and the dark purple represents 47.5% or more of the population. As you can see, there are very diverse communities in America. This can cause a problem. Who is affected by this? The healthcare professionals and the non-fluent English speakers. What is the problem? The language barrier, miscommunication, and the lack of proper translation leading to insufficient care. When? It's modern day America, where America is the focus, but it happens all around the world. Why does this problem exist? Because money and lack of resources in healthcare facilities to provide proper translation and resources. How did it become a problem? America is a multicultural population, but the medical field isn't. How do we fix the solution? We don't exactly know. Is it governmental or an educational solution? Health literacy amongst English-speaking Americans is at a 5th grade reading level. This means the average adult understands medical terminology a 5th grader should. Now try imagining yourself trying to get cough syrup in Morocco. I definitely could not do it. The situation is similar for those who cannot speak English in America and are trying to get care. So the health literacy for a secondary English speaker is going to be even lower than the 5th grade reading level. Without clear communication, care is unmatched, and even with interpreters, there are more reports of adverse effects, non-adherence, and dissatisfaction. The graph on the left shows the millions of people who speak hundreds of different languages in just the 15 largest metropolitan areas in America. New York City has nearly 200 languages and over 15 million speakers of these different languages. The most common spoken languages in America are English, Spanish, Chinese, Filipino, and Vietnamese. Of course, we can't expect our doctors to speak every single language. Sometimes it doesn't even make logistical sense. It'd be ideal to understand everything your doctor is trying to tell you, but for some languages, the population isn't large enough for it to be logistically possible to have a doctor trained in that language. That's why there are translating systems. In a pharmacy in West Lafayette, there's a translating system through that telephone where you can dial for a specific language and it will transfer you to a center where it can help and clarify any questions somebody who's not confident speaking English about their medications. Of course, many underserved facilities cannot financially afford this resource. So as the health community works for a solution in the future, the healthcare professionals should understand the language barrier exists in the healthcare and the consequences can be detrimental. So an extra effort should be put in to ensue confidence and safety between the healthcare professional and the patient.
Hi everyone, this is Namishi and my topic is availability of counterfeit drugs. I want to open this topic by defining what they are, and this slide gives a really good definition as put by the World Health Organization. Basically, these drugs are the ones which are produced in the market that do not have an approval by the FDA or other governing bodies. They may have an incorrect active ingredient or at times not have an active ingredient at all. So as you can see from the slide, it basically talks about several classes of drugs which are sold as counterfeit drugs. The most common made counterfeit drugs are the antibiotics. Basically, these are sold without a prescription, and when a person takes these drugs, it makes them more sick rather than making them better. This slide basically talks about the amount of counterfeit drugs which are seized by the US government in fiscal year of 2014. $73 million worth of pharmaceuticals were seized, and this accounts for 24,000 items in the fiscal year of 2014. As per the graph, China, Hong Kong, and other countries such as India, Brazil, Guatemala, Lebanon, Russia, and Peru account for most of the import of fake items in the United States. This totals up to $1.2 billion worth of items which are sold in the United States and which are fake. So this figure basically sums up the largest seizures of counterfeit drugs all over the world. So far, I have talked about the statistics of counterfeit drugs in the United States, but as you can see that these drugs are more common in other countries as compared to the United States. One of the main reasons is because of the strict rules and regulations followed by the FDA and other governing bodies such as the US Homeland Security. It makes it really hard and difficult for the manufacturers to sell these drugs, and counterfeit drugs in the United States make up for only 1% of the total drugs all over the world.